Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Ever wondered what trachea foreign bodies are and why they pose such a grave danger? Let's start from the beginning. The trachea, commonly known as the windpipe, is a crucial part of our respiratory system, allowing air to travel from our mouth and nose down to our lungs. Now imagine an object, something that isn't supposed to be there, lodged within this vital passageway. That's what we call a trachea foreign body. This could be anything from a small piece of food to a toy part swallowed by a curious child. The real danger lies in the obstruction these foreign bodies create. They impede airflow, and in severe cases they can completely block it. This can lead to serious, potentially fatal complications such as choking, suffocation, or even damage to the trachea itself. Now that we understand what trachea foreign bodies are and their potential risks, let's delve into the causes. What causes these unwanted intruders in our trachea? Well, the most common cause is the accidental inhalation of small objects. This is particularly prevalent among children who, in their curiosity and exploration, may put small toys, beads, or food in their mouth and inadvertently inhale them. But it's not just the kids. Adults, too, are at risk. In their case, the culprits are often food or liquids that are aspirated or breathed in, rather than swallowed. This usually happens when someone is eating or drinking and suddenly coughs or chokes, causing the food or liquid to be misdirected into the trachea instead of the esophagus. Certain conditions can also increase the risk of aspiration, including neurological disorders, dental issues, and conditions that affect swallowing. The very young, the elderly, and those with impaired consciousness are particularly susceptible. Identifying causes is the first step, but what signs should alert us to a possible foreign body in the trachea? How does our body alert us to a foreign body in the trachea? Well, the body has an innate defense system that triggers certain signs and symptoms when something unwelcome invades the trachea. Picture this. You're comfortably enjoying your meal when suddenly a piece of food goes down the wrong pipe. The immediate reaction is a bout of coughing, a reflex mechanism to expel the foreign object. But what if the foreign body gets lodged in the trachea? This is when the situation becomes more serious. The individual might experience difficulty breathing, wheezing, or even choking. Some might also notice a change in their voice or develop a high-pitched sound while inhaling. These symptoms should never be ignored, as they could indicate a life-threatening situation requiring immediate medical attention. Understanding the signs and symptoms is crucial, but how do healthcare professionals diagnose this condition? Let's delve into that in our next segment. When it comes to diagnosing and treating trachea foreign bodies, what methods do healthcare professionals use? Diagnosing these intruders typically begins with a thorough physical examination. Physicians will look for signs such as difficulty breathing, coughing, or a change in the sound of the patient's voice. Next, imaging studies like X-rays or CT scans are often employed. These can provide a detailed picture of what's happening inside the trachea, revealing any foreign bodies that might be causing trouble. In certain cases, a bronchoscopy might be necessary. This procedure uses a flexible tube with a camera at the end, allowing doctors to visually inspect the trachea and lungs. Treatment typically involves removal of the foreign body. This may require a bronchoscopy, or in more severe cases, surgery. The goal is always to clear the airway as quickly and safely as possible to prevent further complications. With appropriate diagnosis and treatment, outcomes can be positive, but isn't prevention better than cure? How can we prevent these dangerous foreign bodies from invading our trachea? The answer lies in a few simple but critical steps. Firstly, close supervision of children while they eat or play is essential. Kids are naturally curious and may put small objects into their mouths without realizing the potential danger. Secondly, encourage mindful eating and thorough chewing. This not only aids digestion, but also reduces the risk of food particles becoming lodged in the trachea. And finally, avoid talking or laughing while eating. It's easy to inhale abruptly when we're caught off guard by a joke or an interesting conversation, which can lead to choking. These strategies may seem obvious, but they're often overlooked in the hustle and bustle of daily life. We must remember that the trachea is a vital part of our respiratory system, and protecting it should be a priority. Remember, prevention is the key to avoid these potentially life-threatening situations. Stay safe and keep those airways clear. UMCC, your ultimate medical consultant connectors.